They go down to that linea aspera, but a little bit higher up. So it's still relatively long, but it's not quite as long as the magnus. So it goes down about halfway down. And then we have the adductor brevis right here, which is farther up. So the longest went into this area here. The magnus covered all of that, all the way down, including here. Right? And then you have this short little one here, the pectineus. So we had an adductor magnus, adductor longus, and adductor brevis. Okay, so three with the name adductor. Then you add pectineus, and you add gracilis, and that's the medial compartment. Okay. So which one of those muscles in the adductor compartment crosses two joints? Gracilis. Yeah. Okay. And that's the one that, so you have this pes-inserine area where these all three muscles go together, and they're coming from different compartments. You have the sartorius that comes from the anterior compartment, you have the gracilis that comes from the medial compartment, and then you have semitendinosus that comes from the posterior compartment, and they all end up together. And then we'll go over that and we'll do palpation. It's in the, yeah, it's part of the adductor compartment, right? Because it's the one that pretty much just goes straight down here. Like if you're measuring for Taylor or whatever, they measure your inseam, that starts out going right along where the gracilis is. So then there it shows the medial compartment again. All right, so talking about the posterior compartment, but unfortunately that's not a picture of the posterior compartment. So posterior group is going to be again the hamstrings. Okay? So there's three muscles that make up the hamstring. You have the, on the lateral side you have the biceps femoris, and then you have the semitendinosus and semimembranosus on the medial side. And that's in the thigh. But then we also have some that cross the hip. Okay? So first we'll talk about the ones that cross the hip. Okay, so we're looking at the posterior part of the thigh, but also we're going to include the gluteal muscles. Okay? So those are ones that are going to cross the hip joint. Okay, so we talked a little bit before about the gluteus maximus. Okay, that's going to come off the posterior part of the ilium, also the sacrum, and the coccyx. Now, you know what? I wasn't using. I made a bunch of those. Made a bunch of handles like we did last time, where it has the bones on them. So I should have passed those out so we could have been drawing on those. We'll go over them again after the break so that we can review all the muscles. So gluteus maximus is going to be the posterior ilium, part of the sacrum and the coccyx, and then it's going to go into that gluteal tuberosity we had on the back of the femur here. On the back, it's just distal to the greater trochanter. So it's like down here. So it's on the posterior side of the femur, just distal to the greater trochanter. So part of it's going to go into bone, and then again part of it's going to go into that iliotibial band or the fasciolatum. Okay, so it's going to go into that gluteal tuberosity on the femur, but it's also going to go into that fascia, or the iliotibial band. So the gluteus maximus is going to do extension of the thigh and also abduction, and it's going to do lateral or external rotation. Because the fibers are running across like this, so it's going to pull out that way. And let's see if this works. So this has the gluteus maximus taken away, and then this is going to be the gluteus medius in here, and then it's going to be the piriformis, and we'll get to those. So we talked about the gluteus maximus. Now we're peeling off the layer of the outer muscle. You have the gluteus maximus, and then you have gluteus medius inside of that. Okay? So gluteus medius is going to come off. The gluteus maximus comes from the actual top of the ridge right here, and then the gluteus medius is going to come out from underneath. I should be able to show you that on here. So if this was the iliac crest here, the gluteus max is going to come off the top of it, and then just underneath it here is going to be the gluteus medius. Okay? So that's this one here. And that's going to go right into the greater trochanter. Okay, so what's that going to do? Pretty much just going to be straight abduction. Okay? Gluteus medius had more of an angle like this, so that also did the external rotation. But gluteus medius is going to be pretty much just abduction. And then underneath that, we're going to have one more, which is going to be the gluteus minimus.
Should we cross off medial rotation for the medius, or?
It's still part of the action, but the main one's going to be abduction. Yeah. It's also going to do medial rotation just like the TFL is. Okay. But actually the main thing that comes into play with that is that it does abduction if the leg is up in the air, but if the leg is fixed, it's going to do this motion here. So it's just like the psoas. If the leg is moving up in the air, the psoas is going to flex the hip. If the leg is anchored, the psoas is going to flex at the pelvis here. If the lower extremity is anchored, and the gluteus medius is going to bring the torso towards that leg. Okay? And that's going to be important in lateral stabilization of the pelvis. So when I stand like this gluteus medius is going to contract here to hold this up. Okay? So just think of the gluteus medius as like for lateral stabilization like this. It's not just abduction of the thigh. It has to do with holding the pelvis. Right? So I think we talked before about the difference between closed chain movements and open chain. Right? Remember what that is? This would be open chain. And then this would be closed chain. Okay? So it closes it when you're in contact with the ground. So what that does is it makes all your muscles work as a chain. One thing affects the other. Versus if I'm just going like this and I'm just flexing my hip, it doesn't get affected by all the other joints. But when you plant it down on the ground and you move like this, then it's a closed chain. And that's where you talk about things like this. So then we have gluteus minimus. Okay? So that's just going farther down. So you have gluteus max that came way up on the ridge, then gluteus medius was in here, and then gluteus minimus. And that's again going to go to the greater trochanter. Okay, so that's just a deeper layer. It's going to do the same kinds of things, abduction of the hip, and then internal rotation of the hip. But the main action is going to be the abduction. And this one we're really going to cover more when we do the lower leg. Okay? So that's what crosses the knee. So gastrocnemius is going to cross the knee, and it also crosses the ankle. So don't worry too much about this one now. It's just kind of a preview of what we're going to talk about later. All right, so let's take a break before we do the rest of the hamstrings. And then I'll find the thing that's amazing.